Today I'm going to show you some tips and tricks on assessing and treating calf injuries, show you some ways of doing that outside of the treatment room. Also, for support and preventative means, I'll show you some myofascial taping techniques. The calf muscle is made up of three muscles really, that is the medial gastrocnemius, the lateral gastrocnemius, and underneath that the soleus. All three blend into the tendon Achilles, which then goes into the heel of the foot and passes onto the sole towards the big toe. If you bend your knees, this stretches the soleus and makes the gastrocnemius more relaxed. And if you straighten your legs and just move your right leg forward, and then if you keep your knee locked, this will actually stretch the gastrocnemius muscle mostly. Okay, bring the legs back please. Muscle tears often occur in this area between where the muscle fibers join the Achilles tendon, or very often they'll be on the inside of the calf, which is more to do with the control of pronation. So gastrocnemius actually controls the dorsiflexion of the foot, and the soleus actually controls the flexion of the knee. Injuries to the calf muscles can be supported and prevented by using the myofascial taping methods. In this case, I'll show you a way of taping the medial side of the calf. This is best done with a calf stretch, so if we bring your right leg forward. Okay, so now the calf is nice and stretched. We'll actually round the edges of the tape, we'll do that very quickly. Create an anchor. So this is the anchor and this is not placed under stretch. And now I'm going to stretch the tape by almost 100%, about 90%. And just on the medial side here, there's the anchor. And just to activate the glue on the actual tape, you just give it a good rub. I can do the same thing on the medial side, on the lateral side, sorry, here. Okay. In the case of a whole calf strain, I'll just round these edges again. That prevents it from fraying and coming off. This will last about a week. You can shower, none of that's a problem. Now I'll just apply almost about a 90% stretch. It's going to support the lateral gastrocnemius. It's better to do this, I think, on weight bearing and in a stretch position. You can do this on a plinth in a stretch position, but you then don't have the weight bearing aspect. So it's better to do this in this way. For soft tissue work to the calf, it is best to place a cushion underneath the shin bone to flex the knee slightly to then relax the actual musculature in that area. You do need a medium. This is arnica balm, which is extremely good for reducing any bruising that may have occurred in the injury. Your contact point's best to be the thumb or the pisiform. Thumb for nice longitudinal work, going up towards the knee, feeling your way as you go. You will then feel areas of tightness, like just here. This is best tackled using the pisiform because it's much more accurate and you can get a very firm but gentle pressure on that area without hurting the client. Because the calf has to bend when we walk, it has to pronate and supinate, pronate and supinate. it's a good idea to put some lateral stretching through the muscle to allow it to do that. So I do it in this way. So laterally, and medially. You can then apply a dorsiflexion and plantar flexion through the ankle to actually stretch and do the soft tissue at the same time. This is very useful in the latter stages when the client is maybe 80–85% better. Actively assessing your client is very helpful. In these clips, I'm showing you how to stress the calf in different areas to ascertain where the injury is.